Cardiac repair after myocardial infarction. Definitions: myocardial infarction or acute myocardial infarction is the medical term for an event commonly known as a heart attack. It happens when blood stops flowing properly to part of the heart and the heart muscle is injured to nerve and abscess. Usually, this is because one of the coronary arteries that supplies blood to the heart develops and blood aids down to an unstable buildup of white blood cells, cholesterol, and fat. The event is called acute if it is sudden and serious. Signs and symptoms. Patient with typical myocardial infarction may have the following prodromal symptoms in days preceding the event. Although typical stem may occur somewhat with warmth, fatigue, chest discomfort. Typical chest pain in acute might have the following characteristic: intense and onward for very unsafe signals. Retrosternal and often radical up to the neck, shoulder, and down to the ulnar aspect of the left arm, usually described as a substernal pressure sensation that also may be characterized as screams, burning, or even discharge. In some patients, the symptoms is epigastric with a feeling of indigestion or a fullness and gas. Cause. There are many causes to myocardial infarction. Two of them being when the blood flows to part of your heart. A coronary artery is blocked by plaque, fatty deposits, or by a blood clot. Many factors can cause a heart attack, such as smoking, overweight, high blood pressure. Application in medicine. When a doctor suspects that their patient has myocardial infarction, they will do a number of diagnostic tests, such as laboratory tests looking at the troponin levels, which is a contractile protein not normally found in the blood, and doing a blood content. Taking an EKG electrocardiography will look at the electrical pulse of your heart and chest X-ray. Application in medicine. Electrocardiography. The electrocardiography is the most important tool in the initial evaluations and treatment of patients in wound and acute coronary syndrome. Such myocardial infarction is a step. It is a component of the diagnosis in approximately 18% of cases. Cardiac imaging. For individuals with highly probable or confirmed acute myocardial infarction, coronary angiography can be used to define diagnosis of or coronary artery disease. Laboratory studies, biomarker enzymes, troponin levels, creatine kinase, myoglobin levels, complete blood count, chemistry profile, lipid profile, and G-reactive protein and other inflammation makers. Prognosis. Acute myocardial infarction is associated with a 30% mortality rate. About 60% of the deaths occur prior to arrival at the hospital. An additional 5 and 10% of survivors die within the first year after their myocardial infarction. Approximately half of all patients with a myocardial infarction are hospitalization with 1 year of the incident. Better prognosis is associated with the following factor: subset early perfusions. ST elevation, myocardial infarction, stem, goal, patient arrival to the field, fibrinolysis, infusion within 30 minutes, or patient arrival to the percutaneous coronary interview within 90 minutes. Precept left ventricle function, short-term and long-term treatment with beta blockades, aspirin, and angiotensin converting inhibition. Complications. Complications of acute myocardial infarction include ischemia, megaline, arrhythmia, embolism, and inflammation disturbance. Nevertheless, circulate failure from several left ventricle dysfunction or one of the mechanical completion of myocardial infarctions were most effective. Treatment. When a patient has a heart attack, usually there is prescribed a medication that helps their tissue repair. It is cell-appearing enzyme that was lost, that or they go under invasive surgery. Some drugs the user aspirin, reduce blood clotting, nitroglycerin help open arterial blood vessels to improve blood flow. Some surgeries include treatment coronary, angioplasty, and stent coronary are bypass surgery. Issue applying Ecuador cardiovascular is currently Ramphers main cause of death are becoming more prevalent in the current country. Among exciting cardiovascular disease, the most feared disease is myocardial infarction. Although there are no real statistics in Ecuador, it is worth mentioning that in the United States there are around 1 million heart attacks per year happen, of which a quarter can be fatal and affects individuals during their most productive years, leading to social deterioration and significant economic implications. Disease or acute myocardial infarction could be close. Myocardial infarction is common precipitation or coronary artery disease. The World Health Organization estimates in 20 serious deaths of working death were from ischemia heart disease. Conclusion: myocardial infarction is the irreversible necrosis of heart muscle secondary to the prolonged lack of oxygen supply ischemia. Approximately 1.5 million cases of myocardial infarction occur annually in the United States.